Greetings. Let us talk about various types of sprays that are utilized in endoscopy. Sprays are used basically for screening, whether it is esophageal squamous cell cancer or finding dysplasia in Barrett's esophagus, or patients with inflammatory bowel disease for several years. In those patients, when you do a screening colonoscopy, you want to find those subtle flat lesions, and also in patients with familial cancer syndromes like the Lynch syndrome, so where the lesions can be flat and you may not find it with a regular endoscopy. In those conditions, you use a spray of different material. So when your physician says that, okay, we're going to do the screening procedure with a spray, you should go back to your counter and look for the spray catheter and various types of medications that are used for that particular case. And let us review what you need. We need a spray catheter, and sometimes you can do the spraying in the colon using the water jet as well, by putting the material into the water canister. So either the spray catheter or the water jet. And in terms of medications, either methylene blue or indigo carmine. These are the blue dyes that are used in the colon for patients with Lynch syndrome to check for flat lesions, and for patients with inflammatory bowel disease, i.e. ulcerative colitis or Crohn's disease for several years, and you want to screen them for subtle flat lesions. And when it comes to the esophagus, we use Lugol's iodine for squamous cell cancer, and we use acetic acid for patients with Barrett's esophagus. You could also use acetic acid to check for subtle serrated adenomas when you don't know how extensive is the lesion. The acetic acid is useful in that condition as well. So let us look at how we use these blue dyes. Blue dye could be methylene blue or indigo carmine, and you could spray it with a catheter, or you could use the water jet. So when you have a patient with inflammatory bowel disease or Lynch syndrome, you need a very clean colon, and once the physician reaches the cecum, he wants to use the dye spray. So if you want to use the water jet, you take 2 vials of either methylene blue or indigo carmine, and then mix them in either 250 ml of water, or if you have a bigger jar, you can use 1500 ml. But the goal is to have a light blue, sky blue color, and that is important to do. And when you go to the cecum, you spray the dye. So as you can see here, the colon is clean. You suction off all the fluid and you start spraying. And when you spray, you will see lesions that you may not have seen otherwise, especially when they are very flat and very subtle. So this dye spray chroma endoscopy is useful in finding subtle flat lesions in patients with inflammatory bowel disease, i.e. ulcerative colitis or Crohn's disease, and also in patients with Lynch syndrome. Lynch syndrome is a condition where families are at high risk for colon cancer. It can go from grandfather to father, father to son, and it can go through several generations of family members who could be affected by colon cancer. So, next, let us look at Lugol's iodine. This is 1.2% Lugol's iodine, and this is used for screening squamous cell cancer of the esophagus. So, this is what you do. During upper GI endoscopy, you come all the way to the gastroesophageal junction, and then from there onwards you spray Lugol's iodine spray from the lower end all the way to the upper end. And normal squamous cells are rich in glycogen, and they take up the Lugol's iodine and give a brown color. If there is a precancerous cell or a cancerous cell, it does not take up the stain, and it shows up like this, non-stained areas, as you can see here. And you either take a small biopsy from there, or you may consider sending that patient for a resection, which can be done either by EMR, that is endoscopic mucosal resection, or endoscopic submucosal dissection. So, Lugol's iodine is used for screening especially squamous cell cancer of the esophagus. Next, let us look at acetic acid, and this is vinegar. So, acetic acid, when you go in and spray onto the Barrett's esophagus, what happens is the Barrett's esophagus turns white. It is called acetowhitening. And what happens is the dysplastic cells don't keep that whitening for a long time. They appear as non-stained areas, and those non-stained areas, as you can see here, are the dysplastic, D for dysplastic or precancerous areas. You identify those areas, and those areas you may not be able to see with the regular endoscope, and you may use acetic acid spray to identify those areas, and then take biopsies from those specific areas to document dysplasia. So, in summary, we talked about different types of sprays. Blue dyes, methylene blue, indigo carmine, used in the colon for screening patients with Lynch syndrome who are at high risk for cancer, and patients who have had inflammatory bowel disease for a long time, at least 8 to 10 years. We also learned about Lugol's iodine, that is for squamous cell cancer screening, and then acetic acid for Barrett's esophagus. Acetic acid could also be used to assess the extent of serrated adenomas. If you think you are not sure about the definition and how far it is extending, spraying a little bit of acetic acid on this flat polyp will define its true extent. And we can either spray through a spray catheter or use a water jet. Thank you.